Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Welcome back to the Southern 7 podcast. I'm Shauna Ryan, and joining me today are Dr. Jonathan Walters and Alicia Paris, both with Massac Memorial Hospital. And the reason for this podcast, folks, is we are in the middle of Colorectal Cancer Awareness Month. That's March. And so we've got a lot of events going on, and one of them is their event that they have coming up a little bit later this month that we're going to talk about. We're going to also talk today about getting a colonoscopy, what to expect there, the importance of getting a colonoscopy, who should get a colonoscopy, and a lot more. But before we dive into all of that, I want to take a little time and introduce our guests and give them a chance to tell who they are, where they're from. Of course, I think I already said that part, but let them give a little more detail. So Dr. Walters, let's start with you.
I'm Dr. Jonathan Walters. I'm originally from Southern California. I moved to this area and went to college in Evansville. Met my wife, who is a local Illinois girl, and we've set up roots here. We now have 4 kids and living the dream here in Paducah and Metropolis.
Wonderful. And what do you do at Massac Memorial Hospital?
I am the medical director of the clinic here. We have 3 different clinics, one with me, one with Dr. Patel, and then the other one with Dr. Connell, who's overdoing the mental health aspect. I'm also the chief medical officer of the hospital.
Oh, wow. So you have a lot of hats at work and at home. So yeah,
Yes.
kind of works that way. That's how it goes. So good. Thank you so much.
Absolutely. Glad to be here.
And folks, we've partnered with Dr. Walters and Alicia on a lot of different events that we've had. So it's good to actually have them on our podcast today. So thank you.
Thanks for having us.
Alicia, tell us a little bit about yourself.
Yep. So I am from Livingston County, and so I reside in Smithland. I have 3 children. I've been in healthcare for many years, started out as an athletic trainer, so working on the sidelines with athletes, and have done anything from pharmaceuticals to home health. And now I'm here at the hospital at Massac, going on my 2-year anniversary. So I am the physician liaison and marketing manager. So working with outside physicians, promoting the ancillary departments that we have within the hospital, and then our clinics as well, and then doing the marketing aspect and community engagement for the hospital too.
Wow. So you're very busy as well.
Yes.
Awesome. Well, thank you again for taking time for us today. So let's go ahead and just jump right in and talk about Colorectal Cancer Awareness Month. It's not something that we just do in our region. This is a nationwide effort.
Yes.
Help get people more information about getting a colonoscopy and pre-screening and what they need to know. So healthcare providers throughout the country are doing this. And before we dive into your event and talk more about the event that's coming up, Dr. Walters, who should be thinking about getting a colonoscopy and getting those screenings?
The average individual that needs a colonoscopy is everybody who's over the age of 45. It used to be 50. They changed this a few years ago. So now everybody who is over the age of 45 qualifies and should get a colonoscopy. There are a few other caveats that you might consider. So one of those may be family history. So if I have a first-degree relative, that would be a parent, a sibling, or a child who has had let's say some type of colon or rectal cancer earlier than that age, I now need to have my colonoscopy 10 years younger than my youngest family member. So if my father had cancer at 50, I should be getting my first one at 40, and so on. So average individuals start at 45, and if there is some family history, it may go younger than that, depending on if there are family histories. There are some genetic things like multiple polyps that can happen in some people. These run with families, and so in those types of situations, you may be having children getting them just to make sure that there's no cancers and earlier screenings. Average individual, 45 and above.
So if you're not 45 and above, people get concerned about their insurance covering it and so on. Can doctors advocate for the patient to go ahead and get that screening done and with insurance, or can you answer to that?
So there's a lot of caveats to that as well. Every insurance is going to be different. With a lot of the changes that happened with the Affordable Care Act, a lot of changes that have happened over the last several years, many of these screenings are required to be covered by most of the insurances. And I put most into a quotation type thing. Sure. Because it's always up to the patient to talk to their insurance and to make sure that they're aware of what services their individual insurance provides. We've seen a lot of the similar issues with some of the weight loss medications that are out now, that some insurances cover them, some don't. But with colonoscopies, when the governing bodies, when they come out and they say this is now the guideline, the USPSTF, United States Preventative Task Force, when they make their recommendations, it's hard for the insurance to say no when this is now a governing body of the nation. So unless there are issues with any individual insurance, most people who are over the age of 45 should qualify for a colonoscopy or some of the other types of colon cancer screenings.
Mhm.
There are other options. Colonoscopy is just the gold standard and is best on the market.
Yeah, and some of the others we mentioned, we offer FIT here at the health department, which is a fecal test. There's Cologuard. There's other means. So as long as they're doing something to get them started, and again, FIT and Cologuard do not replace a colonoscopy.
That is exactly correct. And that's what a lot of people mistake is they think that, well, if I do this, I don't need a colonoscopy. So the benefit of a colonoscopy is the fact that it's both diagnostic and therapeutic. So if I go in there and I see a polyp, they cut it out. And by me, I mean a gastroenterologist or a surgeon, somebody who's doing the scopes. That's not something I particularly do myself, but I recommend all my patients to go get those done. So when they're doing the procedure, they find it, now they cut it out right now. They will then evaluate that, and if it is cancer or was cancer, guess what? That's now gone. Whereas with the FIT testing, it has its limitations. Fecal occult blood testing, or just what we used to call poop blood testing, that's even less beneficial. The FIT testing is better than that. Cologuard is better than FIT. There are some new blood work that are coming out that may have some benefits as well. But again, if any of those hit positive, it doesn't say that you have cancer. It says you need a colonoscopy. So the baseline should be colonoscopy. Those other things are if colonoscopy is not advisable, or if there are other circumstances that we may not know about. There are also limitations for age. Some of the things like FIT testing and Cologuard are not recommended for some of our older population.
Right, exactly. And I can speak to the fact, we had the FIT program here at the department, which I mentioned. Yes. Of the patients that had a positive FIT with Southern 7 and went on to get a colonoscopy, over 60% of those actually presented with polyps. And nothing was cancerous, but they went in, they got the polyps and got them taken care of. But that's the thing, if you have a positive FIT or Cologuard, you need to get in and get that colonoscopy done just to rule out anything serious. So yes, I'm glad
every one of the tests has its own what we call sensitivity and specificity. So sensitivity is looking for the true positives. So if you have the disease, you test positive. Specificity is a true negative. So every test has its benefit and its pros and its cons, right?
Mm-hmm.
And so what we hope for is a test like the FIT is going to capture those individuals who may have been on the fence and really I don't really want to, but I'm interested. Uh-huh. So if it hits positive, now it's even more information if you really need to do the colonoscopy. So exactly. Perfect. Yep.
Exactly. And Alicia, do you have anything to add to that?
I don't. I mean, I think the reason that we are all advocating for this is because it's about awareness. And we know that cancer touches just about every one of our lives in some way. And if we're dealing with something that can be detected early and can be treated and curable, then we need to advocate that and get that out to the community and make them aware of the resources.
Yep.
Right.
And there's a lot of media and a lot of push on breast cancer awareness, but a lot of people don't realize that colon cancer is the second leading cause of cancer deaths in the United States. 900,000 deaths per year of colon cancer, 2,400 in Illinois alone, deaths. That's not diagnoses, that's actually deaths. Second most common cause of cancer death in the country.
And it's basically the most preventable cancer that there is. If you're getting in there getting that colonoscopy done, yeah.
Yep, cervical cancer and colon cancer are things that we as individuals can actively do to help ourselves to make it much less that we're going to be affected in a negative way for that type of cancer.
So let's talk about the procedure itself.
Sure.
All three of us have been at this a while, and we've heard a lot of different reasons why or why not to get a colonoscopy. What can somebody expect when they have a colonoscopy done? Start to finish, what can they expect?
Okay. So you'll see your primary first, and they will talk with you about your needs. They'll go over your family history, your personal history, whether or not that's a reasonable option. Your primary will then recommend a colonoscopy, and they will refer you to the individual who does that, which is a gastroenterologist or GI doctor. Sometimes some surgeons will do them, but more often than not, it's done by a GI specialist. You'll go for a visit with them. So that very first visit is not a surprise, we're going to do a procedure on you. It's going to be a discussion, kind of going back over the risks and benefits. They will also talk with you about what options are available. So you can have these with anesthesia to where they basically make you that you're not aware that it's happening. There's also a awake version that you can do if that's what you prefer, if you're fearful of anesthesia or other opportunities there. Talking with the specialist and getting what is going to be best for you and your own belief system can be very powerful to going that next step. So it's important to know that very first step is not jumping right into the procedure, but is talking to the expert on who's going to be doing the procedure with you. And I say with you, not to you, because that's what a lot of people feel, is that this is something happening to me. They're doing it to me. But no, this is a hand journey. We're doing this together. And so you'll have that first conversation, and then they will talk with you about bowel prep. There's a lot of information that is out there on the web about bowel prep, whether or not we use a Miralax prep, whether or not we use a Go Lightly prep, different chemicals. So there's one called mag citrate that you can buy at the dollar store. There's different preps that they'll do. And the idea here is we want your intestines cleaned out so that during the procedure, I can see the actual lining of your intestine. Many of us have an American diet. Many of us eat things that probably are not the healthiest, and that can cause, constipation. That can cause excess feces. That can cause issues to where if I'm trying to look in there to actually look at the belly wall, I can't see it if it's coated with feces. So the idea and where most people have their issue is I can't handle the prep. I don't like the prep. And it is much better today than it used to be. It's smoother, it's easier on the stomach, but yes, there will be some unpleasantness when we're having to try to clean out our bowels. So that way the surgeon or the GI doctor can physically look at the lining of the walls. You'll do your prep anywhere from 1 week to a few days before, depending on what version that you're going to do. And then you will show up for the appointment that day. Whether or not you have anesthesia or not, again, will be dependent on what you and your specialist have discussed. You will assume the position on the bed. They'll bring you back into their operative suite or to their procedure room, and then they will proceed with the procedure. If you are under anesthesia, you will wake up afterwards and say, "Am I done?" And they'll say yes. Your surgeon has done amazing things behind the scenes to basically protect your life, to prolong your life, to decrease the chances that there's going to be a cancer that's going to rob us of happy, healthy years. But then you wake up and you go back home after that. Then you'll either hear back from the specialist or your primary about what they found. Many people will miss at least 1 day of work, if not a couple days of work, due to need for the procedure. And often there is a transportation component because you'll need someone to take you to and from the thing, especially if you've had any kind of anesthesia. If you're doing this without anesthesia, you may drive yourself there and drive yourself home and either work that afternoon or the next morning. The procedure itself is not painful, it's just more uncomfortable because they're having to take a very long camera and look at all of the lining of the intestines as far in as they can go. And so most people, the biggest issue they have is the fear of the unknown, the fear of the event, or the information that they've heard on Facebook, Instagram, Snapchat, TikTok, or whatever about horror stories or issues or concerns. Every procedure has risks. There are complications that can happen with everything that we do, but the specialists know what they're doing and try to make this less likely to happen.
Yeah, and I've had it done twice, and I'm old enough to say that I've had it twice. And the procedure itself is not bad, especially if you are under sedation. It's not bad. You don't even know it's happening.
Nope.
Really. And
It's
even
the prep.
afterwards, I never even knew it happened. The prep is the worst, but honestly, I found that day before you're not supposed to eat a lot, if you don't eat a lot that day and maybe a day before, the prep isn't that bad. It
Right.
works this way through and does exactly what it's supposed to do. So don't eat like a pig the day you're not supposed to eat. That's really the key to it. But yeah, and I think you're right. I think the majority of people that make the decision not to do it Unless their physician has said out of other health concerns they shouldn't do the test, I think the majority of people just are afraid of what the outcome might be.
Right.
Um,
And there is
that's
an upper limit of
understandable.
age.
Yeah.
You know, there are different, talking with your primary or talking with your GI specialist, you know, when we get into our mid 70s ish, there now becomes a risk that just doing a random procedure may not be the right option for you.
Right.
You
Mhm.
may be a completely fit, healthy 70-year-old, and we may say, oh no, you are physically like a 50-year-old, you need this. Or
Yeah.
you may be a 50-year-old and have the intestines of a 90 or more, to the point
Mhm.
where there's issues for complications. And so that's the power of the primary care. That's the power of talking with the specialist. What are my options? And what are the risks for me as an individual?
Mhm.
I'm not blanketly applying some algorithm somewhere that says just because you're 45, boom, must happen. I'm having a discussion with my patient, like they're my mom, they're my brother, they're my cousin, or my friend, and saying, "Look, man, I love you. I want to make sure that you're getting the best health care possible. This test is available. It is amazing to know that now I can come back in 10 years, 5 years, 3 years, and my health in that organ is great."
Mhm. It's still functioning properly. Yeah, exactly. And we always tell people talk with your primary care physician first, find out what's best for you. So you're exactly right on that.
Yep.
Now, does Massac Memorial, do you do colonoscopies at the hospital?
We have a couple of GI doctors who do come here and they do
Okay.
some colonoscopies here. We've
Mhm.
partnered with a few of them from Paducah who do come here and they do some colonoscopies here. Yes.
Good.
We also offer Cologuard. We've done FIT in the past. We just found
Mhm.
that Cologuard works better for us for our practice.
Sure.
And again, we're looking at alternatives. We're looking at other ways to get more colonoscopies, working at ways of partnering with others. We've partnered with the state for colon cancer surveillance.
Mhm.
So we're working with the state on how to improve access, how to improve opportunities for those in the Southern Seven and Massac County.
Mhm. Yeah, I know that, we had that same partnership through the University of Chicago Medicine and
Yes.
Penn State University, and it's exciting to see that that's expanding out throughout our region, and appreciate your support, Alicia, your support as well, and making sure that that program goes well for our folks here, so they can get the care they need here at home. Now, that's a whole other discussion
Yeah.
as far as the home care. We'll have that another time, but it's good to know that when people are needing a colonoscopy and needing that referral, you guys can offer that to them and get that done. So thank you so much for that. So let's go in and talk about the event that's coming up later this month. When is it? What is it? What's happening there? Alicia, I'll let you share.
Yeah. So it is our Colon Cancer Awareness event and lunch, and it's going to be held on Friday, March 21st, and it's going to be from 11:30 a.m. to 1 p.m. Hopefully we have a great attendance. We've got the old physical therapy department room inside Massac Memorial Hospital that we'll be hosting the event in. Dr. Walters will actually be our guest speaker talking about what is colon cancer, what are our options as far as screenings and preventative care and treatment. And then Southern Seven will be on site with us as well. So we'll have the free fit test and the inflatable colon will be here. So that will be a great teaching tool for people to actually to be able to see what it looks like inside of intestine. And then the Massac Memorial Medical Clinics and rural health clinics will be on site as well. We'll have a lot of information for the community. I hear a lot when I'm in the community, well, I have to go outside of Massac County because they just don't have the services that I need for my care. And that is so untrue. And that's one of the reasons that we do so many community events is because we need to educate the community that we have resources right here close to home to be able to care for you. And so there's resources through Southern Seven and Rural Health and Massac Memorial that we can see you right here and we can treat you and we can get you the resources that you need. So we want to be able to share that so they know that they can stay right here close to home and get the care that they need. If you do want to do a lunch, we are asking that you do call to reserve your spot. That way we just kind of know how much food to have. And I can leave my number at 618-638-1348 and just let me know that you want to be there for the lunch. That way we can make sure to have plenty of food for everyone.
Okay, well,
I'll
very
be
good.
there.
You'll be there. Dr. Walters, are you giving a tour of the colon? Is that, are you,
if,
can I recruit you for that?
if they need me to, I can point out a few things.
Oh, and folks, if you've not seen the inflatable colon, it is something to see. It's like a 20-foot long, 15 feet tall colon. It's lots of fun. Kids love it too. It's one of
Yeah.
those, looks like a big bounce house. You walk through it. So yeah,
It's a
wonderful.
bowel-ast.
It's a what? Oh my
Bowel
goodness.
blast,
A
bowel-ast.
blast bowel. I got to remember that one. Okay, I'm writing that one down because I
Sorry,
know
dad
I will
jokes.
definitely forget that one. Awesome. Okay. Well, we've covered a lot in a short period of time. Is there anything I'm missing? Anything additional we want to share with our listeners today?
We just want to make sure that the community knows this is open to everyone, even if you do not want to come in for a lunch, but you're interested in just hearing Dr. Walters and what resources are available to you. We want the community to come out because we know that the more that we can educate you, the more that we can help empower you to be able to do screenings and detect cancers early. We are giving you opportunities to live a long, healthy life. And so we have so many things that we try to take care of after the fact. And there's so many things that we can do before, cancer actually happens that we can prevent. And so this is just something that we want to make an awareness. It's open to the community. So we invite you to just come on and learn about colon cancer and ways that we can help prevent that. And it may not be something that necessarily involves you right now, pertains to you, but it may be something for a loved one that you can go back and share that information with.
Exactly. Yeah, this may be the conversation starter for
Sure.
a lot of people. And
Absolutely.
it's one of those conversations that we don't like to talk about it, but just like Dr. Walters making the little joke about the being a blast.
Mm-hmm.
You kind of have to go at this at a lighthearted angle. And one thing I've noticed about gastro docs, especially, they have the best sense of humor. They are just the nicest people. So this is a great opportunity to share a rather not pleasant conversation, but a great opportunity to do that. Dr. Walters, did you have anything else you'd like to share?
I think we've touched on most of the things that we want to talk about. It's important to know that colon cancer is very, very prominent. I mean, there are number of cases diagnosed per year. I know I talked about the death rate earlier, but the number of cases diagnosed each year is it's in the millions. It's a very high number. This is not just some rare thing that we don't want to talk about. There's a big portion of behavior that goes into the screening algorithm, the screening process of even the individual discussion. And this does not have to be a fear event. This does not have to be a bad news event. That I would love to say that most of my patients who get colonoscopies come out with good news. And that's very powerful. But a lot of times we're so afraid of bad news that we put off even going in the first place. I see this with my mammograms. I see this with my pap smears. I see this with my even my skin cancer screening. I'm going for my first skin cancer screening here soon. I'm 43. My first colonoscopy is in a couple years. I believe in the science, but this is not a science problem. This is a behavior problem. This is a understanding or a feeling problem. And if we can make one person feel more comfortable and they get one of these tests done, that's one less Illinoisan, that's one less friend or family member that is going to pass away or have some kind of negativity from this cancer.
Right. Yeah.
So
I mean,
everyone matters.
Exactly. And it's always disheartening to hear somebody passing away from colon cancer because, like we've said throughout this whole discussion, it's very preventable. If you can get in there early and get those screenings done when you're supposed to, more than likely everything's going to be just fine. But if you have a history of colon cancer in your family, especially that puts you at a higher risk and at different degrees of risk. So it's important to talk with your doctor about that and go ahead and get that taken care of. So I'm excited that you guys are doing this. I really am. And I know I'm looking forward to it. I hope our communities are as well. Alicia, how can they get more information about the event? Where can they find that?
Sure. So you can go on to our Facebook at Massac Memorial Hospital. We have a lot of our information there. We're going to be doing newspaper as well. So you can find that through the Metropolis Planet, just social media sites as well. So we're trying to get the word out as much as possible. The chamber, the Metropolis Chamber, will have information about that too. If you have questions, obviously you can call me with the number that I had listed, and I can answer any questions that you have.
That sounds great. I believe this is going to be a well-attended event, but if somebody's not able to make it that day, where can they get information from you as far as colonoscopy screenings and things of that nature?
I would say, go ahead,
go ahead.
Alicia.
No,
No,
go ahead.
okay. So I would say at that point, if you are interested and you start that conversation, that is you and your primary care team would be that next step. Because that's what we are trying to do, is to get you to talk with your primary care team to say, what should I do? What can I do? What are my options? Mm-hmm. And so if we can at least even start that with a podcast or with we've already won. We're already winning if we start that conversation.
Right. And talk to people that you trust. Yep. Make sure that conversation is there. Alicia, did you have something to add to that?
Nope, that sounds great to me.
Got it taken care of. Very good. Well, thank you both so much for being with us today and sharing. I'm hoping I do have at least one person that watches this and is able to make a difference in their lives and for those around them. So thank you again. And we look forward to seeing you out on the 21st.
Yep. Thank you for having us.
All right, that's going to wrap up this episode of the Southern 7 podcast. Once again, we've been talking with Dr. Jonathan Walters and Alicia Paris, both with Massac Memorial Hospital. Again, if you'd like more information about the event that's coming up later this month at the hospital, you can visit Massac Memorial Hospital on Facebook. We've also got it on our Facebook page at Southern 7 Health Department, so check that out. And as always, if you'd like to hear other Southern 7 podcasts, we invite you to do so and also invite you to share it with your friends. You can check us out by simply downloading the Southern 7 app or visiting us on YouTube. You can also catch our podcast on Spotify and pretty much wherever you get your podcast. So make sure you check that out. For more information about Southern 7 Health Department, visit southern7.org or download the Southern 7 app, or just simply give us a call at 618-634-2297. Somebody's here waiting to talk to you. From all of us here at Southern 7 Health Department, thank you so much for listening today, and we hope you have a wonderful day.